watching your one-stop shop for health literacy, your health literacy hub, nursing to be and to do. Today, I try to explain the differences and the processes for hemorrhoids and rectal prolapse. Oftentimes, we get them confused and we think they are the same. But hemorrhoids and rectal prolapse are two complete disease states. They are very different. The causes are different. However, the symptoms may present same, which leads to confusion in most situations. Hemorrhoids are a problem with veins. The veins that surround the rectum, whether the internal or the external. So hemorrhoids occur when the veins around the rectum get engorged and sometimes they get inflamed. If these veins engorge outside the rectum, where you could actually touch them with the feel of your hand, we call them external hemorrhoids. When they form inside the rectum, and you may be able to touch them if you lubricate your finger and pass them through the anal canal. But most times we don't do that, we just feel the pain. When they happen inside the rectum, we call them internal hemorrhoids. So hemorrhoids deal with vein problem. Well, rectal prolapse, on the other hand, is a prolapse of the muscles of the lower rectum. So just before the anal opening, the rectum, the muscles over there, prolapse, meaning they suck down. And it could be a complete prolapse where they actually exit the anal canal and come outside of the anus. And you may be able to feel them as you touch. If you feel like there is something stuck, on the outside of your anus and you touch them, you may feel some soft, moist tissue there. That is rectal prolapse, which is the complete form of the rectal prolapse. If the rectum prolapses inside your body and does not exit the anal canal, we call it internal prolapse. So your rectum prolapsed, but it's inside, that is within your anus still. It hasn't exited the canal or the anal opening. So it's called internal prolapse. And then we do have partial rectal prolapse, where part of the muscle that prolapses gets out of your anus and then the rest stays in. That is partial because it's incomplete. Not the entire prolapsed rectum exited the anus. Therefore, it's incomplete. And the causes for the hemorrhoids and the rectal prolapse are very similar. Constipation, straining to have a bowel movement is one of the big risk factors. It puts pressure on the muscles. It puts pressure on the veins that feeds the area, meaning your anus. Also, aging, especially women who are 50 and up. Pregnancy, straining to have a child can trigger a rectal prolapse or even hemorrhoids because it's putting pressure on the vessels, that surrounds the anus. Also, lack of exercise. If you are very sedentary and you do not exercise, your risk of getting constipation goes up. Remember, when you exercise, things move through your gut easily, and therefore your chance of having constipation where you strain to have a bowel movement would be decreased, right? So sedentary lifestyle is one of the risk factors. Aging, especially if you're a female, and childbirth, in the terms of carrying a pregnancy and to delivery, and then having a natural delivery will put strain on that area too. Also, even if you carry a pregnancy full term and you have a C-section, usually pregnancy, the weight and the pressure of the baby still lays on your pelvic floor, and that, transcends to the rectal area too. So, those of us who've been pregnant before, we know that sometimes we feel pressure at that part of our body. That could all increase your risk for rectal prolapse or hemorrhoids. Remember, hemorrhoids and rectal prolapse are very different. And the hemorrhoids, like I said before, it could be internal hemorrhoids or external hemorrhoids, depending on where the veins engorge, right? And then the rectal prolapse is also just the prolapse of the rectum, that is a muscle. And it could be internal, it could be complete, which is when it's outside the body, it could be partial. So the pain, the stress, the feeling of, something stuck between your butt cheeks, as my kids would say, or your anal canal, it's similar. The symptoms are similar, like I said, but the causes and the presentation is different if you take a deeper dive into it. So next time you feel like something stuck between your butt cheeks or something stuck between, your rectum, figure it out to see what it is. Usually a rectal prolapse, when it's complete or it's partial, feels like you haven't been able to empty your bowels fully. It feels like you did go to the bathroom, but you did not totally get rid of everything and it's stuck between the opening. So you feel like incomplete clearance of your bowel. That's how a rectal prolapse feels like. And like I said, the risk factors are aging, and especially if you're a female, you are at an increased risk than our male counterparts. So increasing fiber in your diet, exercising, hydrating, making sure that you do all the necessary things to ensure adequate soft bowel movement or to ease that process would decrease your risk of having hemorrhoids or having rectal prolapse. I hope this has been helpful. Thanks for watching your hub for health literacy, where we try to explain medical things in layperson's terms to you. This is Nursing to Be and to Do, your one-stop shop for health literacy. Thanks for watching.